in Mangalore. Vitamin D, commonly known as the sunshine vitamin, plays a critical role in calcium metabolism and bone homeostasis. But now we know that it also plays an essential role in general well-being. It plays a role in decreasing the risk of many common illnesses by acting on the vitamin D receptors present in most of the cells of our body. Vitamin D deficiency is mainly caused because of inadequate exposure to sunlight, and widespread use of sunscreen is one of the major contributors to it. Certain medication and malabsorption syndromes can also result in vitamin D deficiency. Although there is no consensus on the optimum vitamin D levels in the serum, vitamin D deficiency is defined by many experts as serum 25-hydroxy D levels less than 20 nanogram per ml. Anything between 21 to 29 nanogram per ml is termed as relative insufficiency, and a value greater than 30 nanogram per ml is termed as sufficiency. The aim of my study was to estimate the prevalence of vitamin D deficiency in Mangalore. The objectives were to establish the normal range of vitamin D in apparently asymptomatic individuals and to determine the distribution of vitamin D levels in various age groups and gender. It was a hospital-based retrospective study. The sample size was 771, and case sheets of any person who got his vitamin D levels checked were included in our study. Among the case sheets studied, only those who had unaltered lab parameters other than vitamin D were taken as control. It was done for a period of 2 months, and vitamin D assay was done by measuring 25-hydroxy vitamin D levels. The following tests were used for statistical analysis: Kruskal-Wallis test, Mann-Whitney U test, T-test, and chi-square test. Results: a total of 771 samples were analyzed. This table gives the median interquartile range of vitamin D levels in various age groups. We see that the median vitamin D levels is greatest in the age group of 1 to 10, followed by age group greater than 70, and is the least in the age group of 21 to 30. This figure gives the same data. The mean vitamin D level of the total sample was 20.44 plus or minus 13.90. Of the 771 samples analyzed, 256 were males and 515 were females. The mean vitamin D levels in males was 20.94 plus or minus 14.35, and in females was 20.45 plus or minus 14.81. The p-value was 0.183, and there was no statistically significant difference between the two. This table gives the vitamin D status in the various age groups, and we see that deficiency is maximum in the age group of 21 to 30, followed by age group 11 to 20, and sufficiency rates are maximum in age group 1 to 10 and age group greater than 70. This pie chart gives the percentage of population in the three groups, and we see that 60% of the sample had vitamin D deficiency and only 20% had sufficient vitamin D levels. From this bar diagram, we see that deficiency, which is indicated in blue color, is maximum in the age group of 21 to 30. Of the 771 samples analyzed, 172 were in the control group. The median value of vitamin D levels were analyzed to establish the normal range for asymptomatic individuals. 95% confidence interval for median value of this group was 17.65 to 19.56. From the results of our study, it's evident that age group 21 to 30 is maximally affected by this deficiency, followed by age group 11 to 20. This is supported by various studies, one done by Balasubramaniam et al., which showed that vitamin D deficiency is more prevalent in adolescents when compared to toddlers. A study done by Gordon et al. Showed a high prevalence of vitamin D deficiency in adolescent boys and girls. And a study done by Marwaha et al. Showed low vitamin D levels in school children, that is age group 6 to 16. This age group is maximally affected probably because of increased urbanization, which has resulted in poor outdoor activity and atmospheric pollution coupled with skin pigmentation. Indian diet, which is largely vegetarian, may also be a contributor. An unexpected finding in our study was a relatively higher proportion of samples with sufficient vitamin D levels in the age group greater than 70. This is probably because of their adherence to a routine every day, which involves nutritious food and regular exercise, and also other traditional practices leading to sufficient sun exposure. In our study, we did not find any significant difference in the mean vitamin D levels between males and females, implying that this deficiency affects both men and women alike. This is in contradiction with study done by Harinarayan et al., which showed that vitamin D deficiency hits women more than men. This was not appreciated in our study, probably because of unequal sample size, that is 256 males and 515 females. To conclude, vitamin D deficiency is prevalent in both sexes and all age groups. A high prevalence of this deficiency is observed in the age group 21 to 30, the magnitude of which warrants public health intervention. Approximately 90% of the subjects in the control group had vitamin D levels less than 21 nanogram per ml. This finding questions the functional relevance of 25-hydroxy-D measurement. The present study addressed this issue by obtaining a normal range based on which over 75% of the subjects studied will have sufficient vitamin D levels. This needs to be validated by analyzing a larger population. Before I finish my presentation, I'd like to say that if you want to stay healthy, don't forget your vitamin D. There are 3 ways to get vitamin D: sun exposure, supplements, and food. Thank you.
Can you just show that slide once again? Third slide. You have shown there about supplement, right? After sunscreen, the next one, medications and supplement. Have you screening of the patients regarding the vitamin D deficiency at 21 to 30 years? Have you seen anywhere that the person is suffering with asthma or any other diseases? Because glucocorticoids, as you have mentioned here, they cause at a high range they may cause.
Yeah.
So that is one of the things which has caused to.
We don't have that information actually. We only took the lab values, so we don't really know what disease they had. We didn't really go back to the patient and find out what disease they have or what symptoms they're showing. So it was a retrospective study. We did not go to the patient to find out all that. Maybe we'll take it up next year or something.
Actually, you should have also steroidal anti-inflammatory drugs like paracetamol and aspirin should also be included in supplement, because in malabsorption you have kept liver disease. Under liver diseases, cirrhosis is one of the major cause, where it can also cause vitamin D deficiency. So that should also to be included, and you have to see whether any drug interactions are also causing vitamin D deficiency or not. Thank you.
Something similar to what he said. You did not consider due to why actually they have asked for a vitamin D analysis.
We did not. We just,
okay.
Again, it's
you
a
have vitamin D deficiency,
study, so we couldn't really get that information. We didn't go to the doctor or the patient and find out what actually they came with, what complaints they came with to the hospital. We only took the records, so that information is not available. So only if we do a prospective study.
Vitamin D, isn't it, as
yes,
an outpatient procedure, unless the patient is having some problem. So routinely we don't, as an outpatient for everybody, we don't do vitamin D.
Yes, ma'am.
So how you have taken those patients like?
Actually, I took the data from the lab, so I only got the values. So from there, we got records only of the people who have been admitted in the hospital, so that was not many patients. So we didn't have that much information on what they came with. Thank you, ma'am.